Well, welcome to the Sisters Let's Talk podcast lounge. We are rounding up on the April theme of minority health. Um, we've been following us and following our postings, whether it be it on YouTube or the audio version. You on any podcast platform, you would notice that we've been talking about or around the theme of minority health. Obviously, there's so many things that we can pinpoint when it comes to minority health. And specifically, because this is what we know and this is what we experience, um, we've focused on minority health is not just the Black population, but we've been focusing on um, disparities, health disparities that have been affecting the Black population, the African population, the African American, African Canadian population, and everyone else around the world. So, just a quick recap. At the beginning of the month, we brought in Tony, who talked about breast cancer and just being able to detect, knowing your body and learning about early detection. And also, I think one of the most important takeaway from that is that it can happen at a younger age, especially for the Black population. So not just being aware of breast cancer and breast cancer screening, but being aware that it can happen at a younger age and just being aware of your body, period. Then we brought in Memuna, who talked about mental health and in terms of the stigmas around mental health and our people in getting mental health counseling. And why don't we go to a counselor? Why don't we want to talk to a counselor? And we kind of piggybacked on that again and ended up talking to Tanya as well, who the third week we posted continued the issue on mental health, especially mental health disorders. So this is not just about depression and anxiety, but also disorders such as schizophrenia, bipolar disorder. So just being able to identify those things and being able to bring it up in the communities to talk about it so that people can get diagnosed appropriately and treated. And so at the end of the day, individuals that have these diagnoses, as long as they keep up with their health appointments, can live a very fulfilled life with support as well. So I think these are things that we don't talk about until later. We all like, oh, yeah, maybe that was what was wrong with that individual. And had they gotten help, either they would have been productive in their lives, or unfortunately, some people end up taking their lives. So, mental health, as we all know, is a very big thing. And now we're going to round up the month of April with another topic that is, I don't want to say near and dear to me, but at the same time, I think when you experience it, it becomes near and dear to you. So, in as much as I'm not the champion of it, but I think it's important that we have the conversation, and that is the topic of infertility. I've experienced it, and so Wumi gave me the topic to talk about. And I reluctantly agreed. I've been talking about it, so I wrote a book about it. I go around to different places, conferences, small groups to talk about my experience and my take on it. I have two takes. Uh, they both combined, and it's that one. It's again, I'm a medical professional, so I think I advocate for knowing your health, make sure that you're up to date in terms of your health checkups. And also, the second thing is that in terms of infertility, which is the topic for today, that this is something for some people, they can actually, all they need is certain things medically that will actually help them, or things that can prevent getting to that stage where you have, whether it's primary or secondary infertility. And we've actually had a conversation extensively in the past on this topic. So, and then the third thing for me, and this is personally for me, that at the end of the day, as we focus on the medical aspects, that we also spiritually put our trust in God as well, that because He said He will do it, He will do it. But again, we can't just sit there and say, oh, He said He would do it, which He will, but you also have to make sure that you're up to date on your medical checkups. So in the topic of this infertility, and in reference to minority health, it actually does affect a larger percentage of Black individuals. So no matter where you're from, and also that includes Africans. Now, infertility is not just only Black people. Even Caucasians experience infertility, other races experience infertility. But again, we're talking about minority health. And this is the reason we wanted to bring it up, is because these are topics that people don't like to have a conversation around. You just kind of put two and two together and like, oh, maybe this is what's going on. But most people don't want to talk about it. And so we want to make sure that this is not something like mental health, that these stigmas become a thing of the past and not just continue perpetually. So I want to bring up some things that we should be aware of that can prevent or help to prevent or help to reduce the percentages of infertility. And by the way, over the years, the number or the rate of infertility generally is actually going up. That's another conversation, but I think part of it is also our lifestyle and what we eat, which we would love to talk about in another episode about our nutrition. So there are three things that I will point out today. There's a long list of things that affect fertility rates in men and women. So I'm focusing on the female today, but we have had the conversation for male as well. One of them is fibroids. We are aware of fibroids. Black women have fibroids. In fact, 80% of Black women in general will, by the age of 50, will have some form of fibroid, whether it's a small fibroid, a large fibroid, a uterine fibroid, basically. And there are different types of fibroids, because fibroid is a non-cancerous tissue that grows in the uterus in different places. Depending on where it grows, it can cause very heavy bleeds, significant pain, and these are some things that most people just take for granted, or just take to say, it happens every month, and I get through it. I may take an Advil here, or Tylenol there, or acetaminophen, and I just move on. I can't let anything keep me down, blah blah blah. But if you're coming down the road and maybe trying to have a baby and having some difficulties or some delays, this can be one of the reasons, and it's something that can sometimes, depending on lifestyle, that we can treat. So fibroids itself can be treated. There's no one. In terms of diagnosis, it starts with the symptoms. So it depends on what you talk to the doctor, your doctor about, or your NP or your PA. And then the diagnosis can be made. So at the end of the day, based on your history, you might be sent for an ultrasound, and this is where we can determine, oh yeah, there's a fibroid and it's this size. There are fibroids which can be as big as a cantaloupe or as big as a mango. And these can affect in terms of implantation, they can increase risk for spontaneous abortion, miscarriages, etc. Aside from the fact that you get a lot of bleeding and you're in a lot of pain. One of the things that has been associated with fibroids is obesity, so weight, as well as low vitamin D. Low vitamin D or as vitamin D deficiency or vitamin D insufficiency is found again a lot in Black women, Black individuals, Black people. So just your nutrition, just make sure that your nutrition is good. You don't necessarily have to spend so much money or these days, although these days, I mean, everything is expensive, but at the end of the day, you can still eat healthy without having to always break the bank. So even exercise is cheap. Step outside. You don't have to have a gym membership. Step outside, go for walks. You don't have to have the time to go for an hour walk if you don't have the time. Break it up. 10 minutes here, 10 minutes there. Just move. We move less, and that's one of the issues. Um, so fibroids, they happen to be 3 more times higher in Black women compared to non-Black women. So that's one. The other point that I want to make is ovarian cyst. Ovarian cyst can also increase the risk of infertility. Ovarian cysts can be simple cysts or not. So simple cysts, majority of the time, don't really cause any issues if they're really small and they resolve. Some of them will resolve, some they don't, and you have to have a surgical removal. And then the last one I want to quickly mention is endometriosis. Endometriosis is one that's difficult to diagnose because there's no one particular test to diagnose endometriosis. And the main thing about endometriosis is you can go years having your symptoms and not be diagnosed. The statistics states that some people 7 to 12 years before they can get diagnosed because there's not a specific test. At the end of the day, it depends on what your history is. And sometimes I might say health professionals, again, like even in minority groups, might just pass it off as, oh, they always come and complain of pain. Why don't you just take, over the counter analgesic and move on? But I think you yourself, if you know your body, I always tell patients, yes, they may come in once or twice, and if I can't find anything, I mean, I tell you, we've done some tests, I can't find anything. But if there's something that is persistent, come back because you know your body. And if you keep persisting, either that symptom progresses, gets worse, or we may end up just doing some more tests, which will eventually, if there's something wrong, there are times it's not, there are times it is, but persists. It is your body. So with endometriosis, I mean, it can be diagnosed in the ultrasound because again, we have endometrial lining of the uterus, but endometriosis happens as an inflammatory disease where there's extra growth and it can grow anywhere in the pelvic, in the uterus, and it can cause significant pain. And it also increases the risk of endometrial cancer. So if you keep having all these pains and you're just dealing with it, and that tissue keeps growing, and if it ends up being cancerous, so again, this is not anything that is new, but at the same time, you would be surprised that myself, when I have patients that come over, half the time, some people don't even know what their cycle is. Keep a diary. It's easy. Have an app. There's so many apps now. Just in terms of your periods, is it regular? Is it irregular? Is it something for the past 3 months? Has it gone off? Is it heavy? Is it used to be heavy? Is it always heavy? Are you having blood clots? Are you having larger clots now? Or is your pain getting worse? Maybe you used to have pain that was manageable, and now it just keeps getting progressively worse. It is very good to keep track of these things. And one of the reasons why this is a topic, aside from the fact that it can lead to infertility, it's because these things, fibroids, endometriosis, and many other diseases, but specifically these today, get missed is it's been found that there's delay in diagnosis more so when in these diseases, so endometriosis, fibroids, uterine fibroids in Black women compared to non-Black women, compared to Caucasians. So, like I said, some people, it might take up to seven to 12 years to get diagnosed. So, get your checkup, exercise. Your exercise will help your mental health. Make sure you eat healthy. There's nothing wrong with cheating. Have your cheat days. In fact, the healthiest way in terms of weight management, in terms of quote unquote dieting, is moderation and making sure you're exercising and not wholly depriving yourself. Your brain works differently because it says now, give me, because you've been depriving it of what it's used to. So moderation here and there is better than anything else. But exercise, exercise, exercise. It reduces your risk for so many other diseases. And this young people are at younger age now are dying or are so sick, have so many complications, so many comorbidities that we shouldn't be having. And really, the majority of the time, the reason is lack of exercise, more sedentary, and poor diet. The last thing I want to point out is, which we've been saying in the last three episodes, is stress. And stress is not necessarily mental stress. So mental stress, depression, or you mentally fatigued. If your body is stressed, no matter how your mind is alert and your mind feels free and you're singing and so on, if your body is stressed, and I am not the best person to talk about this because I push and push and push. But one of the things is when your body is stressed, your body makes more cortisol. Your cortisol increases your estrogen production. This is one of the ways that increases fibroids, aside from all other things that we are aware of. So make sure that not just your mind is at ease, but your body is relaxed. And again, exercise can do that. So thank you very much for staying with us for the last 4 episodes. And if you have any comments, you have stories, you have suggestions, make sure you post them on our social media pages, platforms, the audio and the YouTube channel. We are excited about the summer because we have very good speakers lined up for us to just talk about the things that matter to us, talk about the things that affect us. So for us, by us, that's the goal. All right, have a blessed week.